To begin, thank you so much for joining us for our latest media briefing on important healthcare issues in the news. I'm Dr. Rose Zacharias, and I am the new president at the Ontario Medical Association, representing 43,000 physicians. I'm a family physician in OMA President. I work in a COVID-19 screening unit and provide medical coverage to inpatients at Waypoint Center for Mental Health Care in Penetanguishene, and have worked emergency department shifts at Aurelia Soldier Memorial Hospital as well. 6 months ago, the Ontario Medical Association released our plan for better healthcare, called Prescription for Ontario, Doctor's 5-point plan for better healthcare. It's our guide to fixing the cracks the pandemic has exposed in Ontario's healthcare system, and it offers solutions in 5 priority areas: reducing wait times and the backlog of services, expanding mental health and addiction resources in the community, improving home care and other community care, strengthening public health and pandemic preparedness, and lastly, giving every patient a team of healthcare providers and linking them digitally. There are also separate recommendations addressing the particular healthcare needs in Northern Ontario. It's not just our plan. Ontario's doctors conducted the largest consultation in our 140-year history, including public healthcare and stakeholder input. We asked all of Ontario's political parties to adopt our plan. Today, as Ontarians prepare to go to the polls on June 2nd, we are releasing the first of our prescription report cards, telling you how each party platform aligns with our recommendations. The OMA examined every party platform, as well as their public announcements and comments in the legislature relating to healthcare in Ontario. We awarded 1, 2, or 3 stethoscopes, depending on whether a party made a modest, moderate, or most commitment to each of our 5 pillars. The more stethoscopes a party earns, the more aligned the party's healthcare plans are with the OMA's plan, and the more likely Ontario's patients will get the care they need when they need it. The most stethoscopes a party can earn is 18. So far, our analysis found the Progressive Conservatives and the Liberals have 10 stethoscopes each. The NDP has 9 stethoscopes, and the Green Party has 7. The Green Party released their platform with costing shortly before our briefing began just today, and we will look at their platform closely and adjust the report card based on what we see. At first glance, we see some encouraging positions, including strengthening the independence of the province's top doctor and increased home care funding. Only one party got the full 3 stethoscopes in any priority, the NDP, for its recommendations for healthcare in Northern Ontario. The NDP's commitments include hiring 300 doctors, including 100 specialists and 40 mental health practitioners, and taking stronger action to address the opioid crisis, particularly on First Nations reserves. Overall, we are encouraged by the commitments made and the promises offered. More needs to be done against each pillar. We will continue to monitor party commitments throughout the election campaign and report progress on our election website, betterhealthcare.ca. We will continue to release prescription report cards following the campaign to ensure whichever party forms government implements the plan, addresses the gaps in the healthcare system the pandemic exposed, and makes the lasting improvements we need for better healthcare for everyone. Now I'd like to introduce our very distinguished panelists today, the 3 past presidents of the Ontario Medical Association, who will speak about one of the pillars in our prescription or our recommendations on healthcare funding for the future. Firstly, Dr. Adam Kassam, our immediate past president, is a physiatrist at Runnymede Healthcare Centre and Athletes Care in Toronto. Dr. Samantha Hill is a trained cardiac surgeon who works at St. Michael's Hospital and Sunnybrook Health Services in Toronto. She was OMA President for 2020-2021. And Dr. Sohail Gandhi is a rural family medicine doctor in Stayner and holds hospital privileges at the Collingwood General and Marine Hospital. He was OMA President for 2019-2020. Dr. Gandhi, could you please start by telling us about the doctor shortage in Ontario and what doctors would like political parties to do to address it?
Well, thank you very much, Dr. Zacharias. Appreciate the opportunity to talk today. It's no secret that there is a doctor shortage in Ontario, but when you sort of delve into the numbers, it becomes apparent just how significant that is. Currently, Ontario has 2.3 physicians for every 100,000 people in our province. And to put that into perspective, that ranks us as number 7th across the country in terms of provinces. So there are, 6 other provinces that have more doctors per capita than we do in Ontario. And it gets a little bit more jarring when you look at Ontario as a jurisdiction and you compare us to other developed countries. So if you look at, say, the OECD countries across the world that have fully developed healthcare systems, that number of 2.3 per 100,000 would put us at 29th out of 33. So there are a significant number of countries that have better healthcare systems, better outcomes from their healthcare, and they all happen to have more doctors per capita. And I don't think that is, I think that's a correlation that warrants study, frankly. At this point in time, we know that there are at least 1 million people in Ontario, at least 1 million, who don't have a family doctor. And we know that this issue is particularly acute in the north and in remote and rural communities where they really are struggling quite a bit. On a personal note, I can tell you that over the past year or so, I have had some patients who've moved away from my community of Stayner for multiple reasons. And the stories that they come back with are actually heartbreaking. I have a patient of mine who moved towards the Windsor area, to a small community in Windsor, and she's been unable to find a family doctor for about a year. And I've tried my best to manage her virtually, and virtual care is a good idea in some cases. But when she needed a procedure done, she had no choice but to drive 4 hours to my town to get the procedure done, because there are obviously some things you just can't do virtually. I've got another family who has a young child about 7 years old, who has significant medical issues. They moved towards the Sudbury area, and I've been trying to manage those medical issues over the phone, along with help from the pediatricians. But as you can imagine, it's very, very challenging when you can't see people. I've got another patient of mine who moved to the Elliott Lake region, which is about a 4-hour drive from Stayner. And again, not able to find a doctor. So these are real people who are left in a situation where they have to travel 4 or 5 hours to see a family physician when they need that in-person care, because virtual can do some things but can't do everything. And these people are significantly suffering as a result of the doctor shortage in Ontario. And it's with that in mind, I will say that when I saw that 26% of people on our online public survey said not enough doctors was the #1 issue for the healthcare community, I will say that I thought it would be a little bit higher, but it's still a pretty significant number. To try and get a sense of just how widespread this physician shortage is, the OMA's team looked at the data from Health Force Ontario. Now that's a government website that advertises posts for physicians. And they took a look at this website on just one day and looked into 12 different cities in 4 regions across Ontario. And what they found was there was, in fact, an acute shortage in the northern area. So out of a total of 1,800 openings, so that's 1,800 physicians that we need right now as of this moment, there were 150 doctors needed in Sudbury and surrounding areas. There were 70 more that were needed in Thunder Bay. But there are also some problems in urban centers where we would think would not be quite so short. Hamilton and surrounding areas, for example, needed 200 doctors. I already told you about my patient who's in the Windsor area and can't find a doctor. The London and surrounding area communities needed 94. Kingston needed 69. And even in areas like Toronto and Mississauga, there were 639 postings available for physicians in Toronto and 202 in Mississauga. So this is a province-wide issue, quite a bit more significant in the north. Of course, I would never want to deny the north and remote Ontario their needs. But it is a big issue, and it's going to cause concern for the people of Ontario for the next decade. Now, we all know that primary care is the foundation for a healthcare system. Family doctors like myself, our job is to try and prevent disease. We try and keep your blood pressure under control. We try and keep the diabetes controlled. We try to identify colon cancer and cervical cancer and breast cancer at early stages so that the disease doesn't spread and create more healthcare needs. And when there aren't enough of us, those conditions, the diabetes will turn into heart disease, so that my colleague, Dr. Hill, will now have to operate them. And I don't begrudge her the work, but I'm sure she'd prefer if she had less patients to deal with. When you don't treat the high blood pressure, people wind up getting strokes and cost the health system more. So it's really important to address primary care as well. So what does the OMA need? Well, the OMA recommends a couple of things. First, we do need some more data on exactly what type of doctors are needed, because as medicine becomes more complex, it's not quite as simple as just saying, well, we need a family physician in this area. I mean, do you need a family physician who can also work in the emergency department, a family physician who can also do obstetrics? Do you need a specialist, a general specialist in orthopedics, or one that specializes just in hips? Those kind of things, we need that data. We need to support doctors to make sure that there's enough doctors in the right places at the right time. That does mean more medical students and residency positions. And to that end, I was very glad to see that the current government is increasing the number of medical student spots and creating a new medical school. That's a great long-term solution because it takes 10 or 12 years to get a fully trained doctor. So that will certainly help us 10 or 12 years down the road, and I appreciate that. But we need to provide, through digital technology that's available today, we need to provide more support for doctors and medical students who work in rural and racialized communities and remote communities, and to help them have access to frontline advice so they can practice in these communities. And finally, I would say that we need to figure out a way to let doctors be doctors. Like right now, physicians are spending a lot of time doing it. I can't really call it paperwork anymore because everything is electronic, right? It's all in front of the computer and there are all these electronic medical record systems. But we need to find a way to make this stuff easier for doctors. My hospital a year ago actually switched over to a fancy new electronic medical record system. And I got to tell you, it takes me twice as long to see a patient now. And I fully appreciate that this new system provides the hospital with increased patient data and increased administrative data to help them secure funding and all that. But if it takes me twice as long to see a patient, then that's really doing a disservice to the community. And quite frankly, there's so many clicks on this thing that sometimes when I go to the hospital in the morning, I'm not sure if I'm a doctor or if I'm Woody Woodpecker, because I'm always, pecking away at the keyboard trying to figure out what the right button is to press. So those are that's a basic snapshot of the issues around the doctor shortage. I hope you found that helpful, and I'll turn this back to Dr. Zacharias.
Thank you, Dr. Gandhi. And at this point, I'd like to hand things over to Dr. Hill. Dr. Hill, the OMA data shows the significant backlog in surgeries and services created by the pandemic. Are you able to just comment and talk about the extent of the pandemic backlog, and of course, what doctors say political parties should be doing to address it?
Thank you so much, Dr. Zacharias, for the opportunity to speak to this. As you know, it is a topic that is near and dear to my heart, and also welcome to your new position. So one of the things that we've been doing at the OMA over the last few years has been tracking the backlog of work and of healthcare services that the pandemic has created. And the last time I spoke with media, it was at around 21 million healthcare services, and now it's up to 22 million healthcare services. And to remind everyone, that includes doctor's visits, includes surgeries, includes diagnostic tests. All of these things are services. So that's 1 million more that are backlogged now than when we last reviewed the data, and that was just 3 months ago. That's a remarkable increase. And it's really no one's fault. It's certainly not the fault of the doctors who show up to work every day and try and do their best for patients. It's not the fault of nurses who've borne a fair challenge throughout the pandemic. And it's not the fault of patients, for sure. The province had no choice but to shut down a variety of procedures over the course of the pandemic to conserve capacity for COVID patients. And that happened not once, not twice, but several times over the course of the last few years. It was necessary, it was the right decision at the time, and it kept patients and hospital workers as safe as possible. But now we have to deal with that. The result is not just that there are more patients waiting for surgery, but that those patients are showing up sicker and they need more invasive care, and it takes them longer to get better. I'm a heart surgeon, and we are seeing more and more patients come in who have sustained damage to their heart and who take days, if not weeks, to actually recover after the surgery, as opposed to the normal couple of days. It's going to take us months, possibly years, some might even say a generation of healthcare, to actually clear the backlog of knee replacements, cataract surgeries, hip replacements, cardiac surgeries, MRIs, CT scans, etc. And these are the markers that we use because of how we measure data, but it's reflective of everything. All of the procedures and all of the services are way, way behind, and patients know that. You know that because you know your family and you know people who are waiting for care. And so ultimately what that means is that we need more operating room time. We need more hospital bed capacity, because I can't do my job in the OR unless I can hand off that patient for care afterwards. We need ICU bed capacity. We need floor bed capacity. And it leads to longer hours for physicians. It leads to longer and longer hours for other healthcare workers who are already suffering from burnout in unprecedented numbers. Nurses, doctors are picking up the slack for each other and burning themselves out day by day because we care about patients. And we're going to keep going like that. And to give you an idea, clearing that backlog is going to take an estimated, it's going to take an estimated 18 months for heart bypass surgery. It's going to take an estimated 12 months for MRIs, and it's going to take over 38 months for knee replacements. Now, we all know that wait times were a major issue in Ontario even before the pandemic, right? So now this is even worse. This is the context of us having those wait times amplified. And so what does that mean? It means that we're going to see more and more patients come in sicker. And it means that we're going to need more and more urgent healthcare reform. Today, it's the single most important healthcare issue for Ontarians. Sick patients simply cannot afford to wait any longer. So in order to address the backlog and the wait times, Ontario's doctors have recommended, amongst other things, moving many of the non-emergency, less complex surgeries and procedures to new outpatient centers, known as independent ambulatory centers. This will allow us to preserve capacity for the more complex surgeries in places that cannot be moved. These publicly funded centers would provide those OHIP-insured medical services on an outpatient basis, freeing up hospital beds, freeing up operating rooms, nurses, staff, and allowing the hospitals to focus on more complex, more acute, and more emergency patients and procedures, and to reduce wait times. We're going to need, and we have recommended, more home remote monitoring programs to streamline pre- and post-surgical care. Once the surgeries are done, we need to be able to get patients home as quickly as possible. There are very few patients who would disagree with that anyhow, but doing it right now is imperative in order to serve as many people as we can. We need more nurses. We need more technologists in order to expand the MRI and the CT machine hours. We need more education for young people about healthy lifestyles and disease prevention. And we need more integration of all of this healthcare in services that include palliative care, long-term care, home care, and community care. At the end of the day, we need all of these things taken care of because no peg will turn alone. And so to take care of our patients, to take care of our physicians, to take care of our hospitals and our nurses and all of the healthcare workers who have put so much on the line over the last few years, we're really hoping that all of the parties heed these warnings and can implement as many of these suggestions as possible.
Thank you so much, Dr. Hill. And before I turn things over to Dr. Kassam, I just want to say a few words myself about mental health. which is an area that I am particularly passionate about. So my clinical career is 20 years in the emergency department, and also now, during the pandemic, I came to Waypoint Center for Mental Health Care, a 300-bed inpatient psychiatry hospital in Penetanguishene, and I work alongside the psychiatrists providing medical care. And in both of these capacities, I have seen the strain of the pandemic, but even prior to the pandemic, the strain of mental health on people. And I just know from my years in a clinical setting that mental health has always carried a particular stigma. And I don't think that we particularly appreciate even the impact of our mental health on our physical health. We know that prior to the pandemic, 1 in 5 people were speaking up and saying they're struggling with their mental health issues, depression, anxiety, and other mental health issues. And we know COVID was particularly burdensome. The isolation, the restrictions, the lockdowns, the school closures, all of the adjustments and adaptations that families needed to make, despite losing loved ones and being sick and dealing with time off work and all of those stressors. And so obviously it has impacted our mental health. A recent survey of the Mental Health Commission of Canada found that 84% of respondents to the survey reported their mental health concerns worsening since the start of the pandemic. We can't turn away our eyes or our ears or our money when it comes to addressing mental health in the healthcare system. More than 1/3 of those with the COVID diagnosis may develop a lasting neurological or mental health condition. And so now we even have the overlay of COVID, and what does long COVID actually look like as far as impacting somebody's mental health? We know that there's new OMA data that actually shows a significant increase in OHIP billings for mental health issues since the pandemic began. And this is actually just a really narrow capture, really, billings, because not everyone comes forward. Not everyone realizes that this is something that they can go to a doctor or reach out to a healthcare provider for. And despite that, in 2018 to 2020, there was a 14% jump, for example, in a billing code for adjustment reaction, which is a diagnosis around which will have a dysfunctional reaction to stressors and requiring care. And so that is one particular example. And over that same period, there was a nearly 10% increase in services provided for anxiety-related disorders. So we know that people are coming forward, and yet I truly believe that not everyone who is struggling with their mental health, and even as it's impacting their physical health, is getting the care they need because they're not even coming forward. So what are some of the solutions to that? We know we need an increase in publicly funded and community-based mental health teams. So we're talking about psychiatrists, primary care doctors, pediatrician, addiction medicine specialists who do provide excellent care for these patients, but there's an inequity and just a lack of access to a team-based environment that's in the community for people to access. And so Ontario's doctors are calling for greater accessibility and affordability and these publicly funded services in the community so that everyone can get the treatment they need. At this point, I will turn it over to Dr. Kassam. Dr. Kassam, can you please give us an analysis on of how far Ontario has fallen behind other provinces in terms of funding and what it'll take to catch up? Thanks, Adam.
Yeah, thanks so much, Dr. Zacharias. And we know our recommendations for better healthcare have broad public support. In fact, an Ipsos survey conducted for our organization in December showed that 96% of Ontarians said that they support our 5 priorities. And the most recent Ipsos survey for the OMA conducted in late April found that healthcare continues to be the most important issue for Ontarians, ahead of inflation, ahead of housing. So in fact, healthcare is ranked number 1 or 2 by 1/3 of voters going into June 2nd. And so the question to be asked is, how are we going to fund this better healthcare system for the future? And healthcare funding in Ontario isn't keeping up and isn't keeping pace with demand. Per person, the amount of money Ontario receives from Ottawa is less than the amount Ontario sends to Ottawa back. And so this difference has been increasing over time. And in terms of provincial healthcare spending per person, Ontario is 10th out of 10 provinces, unfortunately. And so Ontario can't fund its healthcare system alone. And Ontario's doctors are calling on all political parties to reverse the chronic underfunding of healthcare and put pressure on the federal government to contribute its fair share. And we strongly support calls by Canada's premiers for the federal government to increase Canada Health transfers to 35% of provincial territorial healthcare spending from the current 22%. And that would give Ontario an additional $10 billion a year, allowing the province to clear the backlog of care created by COVID-19 and fix the cracks in the healthcare system that widened during the pandemic. So far, Ontario, unfortunately, has fallen behind in healthcare spending over the past 30 years across party lines, and it needs to invest an additional $5 billion a year just to reach the national average. So these are some of the examples of how chronic underfunding has led to this current situation, and that has been exacerbated by COVID. And I'll turn it back over to Dr. Zacharias.
Thank you so much, Dr. Kassam. Thank you also, Dr. Hill and Dr. Gandhi. We are going to now open up our Q&A session. And Emily English from the Ontario Medical Association will be moderating this portion of today's briefing. So please put your questions in the Q&A chat. I have seen questions coming in already. If we don't get to your questions due to time, the media team will follow up with you. You can also email media@oma.org. I'm sure we'll put that in the chat as well with additional requests for interviews. We will also have a recording of the session available later this afternoon. So over to you, Emily.
Thank you, Dr. Zacharias. The first question is for you, Dr. Zacharias. Is there one thing that you would like to see more of in every party's platform?
I think alignment is key across. We've made it very clear. Our prescription for Ontario is absolutely clear. The pillars we have touched on here today. We have talked about the backlog being the #1 priority for Ontarians. And so what would be great to see is an investment there, a commitment there, a costing there, but also I think we need to think about healthcare delivery differently. And I imagine going forward to catch up on the backlog, these hip surgeries, knee surgeries, cataract and hernia surgeries, and the mammographies and colonoscopy cancer screenings that have always traditionally been under the roof of a hospital need to happen elsewhere. And so the OMA has actually come forward with a very specific recommendation of integrated ambulatory care centers where we could offload from the hospital, still publicly funded, and no one's jumping the queue, but bring these lesser emergent, lesser acute, but very urgent and problematic and worrisome conditions that patients are dealing with into these freestanding clinics and have those procedures done there. I think it would help with the backlog. We're not exactly seeing this as far as an outline for a particular plan. And so being the #1 priority is definitely something that I think we would like to see.
The next question is for Dr. Samantha Hill. Dr. Hill, the number of backlog services has increased by 1 million since the last analysis that the OMA put out in February. So what more does the OMA want to see in party platforms in order to clear this backlog?
Thanks so much for that question. It's a very insightful question. That $1 million services that has increased in our backlog in the last several months, it's shocking that it's still continuing to increase at that rate. And it's really quite dramatic. When we look at what we need to see a commitment to resolving it. We cannot keep doing the same thing we've always done and hope that it goes away. That number is actually an underestimate. And that number is based on predictions, based on what normal utilization is. But we know fully well that the pandemic has hurt people in a variety of ways. We know fully well that a lot of people haven't had the screening that they're supposed to have. We know fully well that people waiting for hip surgery and knee surgery are in chronic pain at this point and have been for years. And we're talking about opioid crises, and we have things that we can do in order to reduce some of those risks and in order to reduce some of that illness and that burden that our population is bearing. And so when asked, what do I want to see? I want to see a firm commitment. I want to see numbers on the line. I want to see people say, yes, we see what this issue is. I want to see all the parties understand the issue. And I want to see them commit to applying finances and political will to solving it. And that means endorsing many of the suggestions, if not all of the suggestions that the OMA has outlined here.
Thank you, Dr. Hill. Next question is for Dr. Gandhi. We know the doctor shortage isn't a new issue, but it's plagued Ontario for many decades. So what needs to be done differently so that we aren't talking about this in another 10 years?
Yeah, so, I'm old, right? I've been practicing medicine since 1992, and I've seen the doctor shortage fluctuate. There have been times when the doctor shortage has been quite acute. 98 to 2001, for example, was really quite bad. Government invested some money into promoting physicians. The shortage got somewhat better. Shortage got worse again. Shortage got better. So you're quite right. It's actually fluctuated over the past 30 years of my career. What do we need to do differently? The first thing that we need to do is we need to, as Dr. Hill was talking about, and I think Dr. Zacharias as well, we need to use the independent ambulatory care centers, because that really does help. Those centers are more efficient. They allow physicians to work more efficiently. That takes a lot of the administrative burden off of physicians, and that allows us to do our jobs better. In the short term, I believe it's actually quite possible to harness the digital technology, give each patient a digital healthcare team. That's recommendation number 5 on our platform. By the way, the recommendations are not, just because they're numbered 1 to 5, it's not in order of importance. They're just 5 recommendations. I believe that recommendation, because I live that recommendation, I'm one of the lucky ones. In my neck of the woods in Collingwood, we have something called the electronic prescription systems. What it does is allows allied healthcare professionals to be on our electronic medical record systems, allows me to send electronic messages to home care now and to pharmacies and the hospital, that sort of thing. That has been a dramatic improvement in reducing my administrative burden, and I wish it was province-wide. I actually tried to get a project at the OMA spearheaded when I was president, and we got sidewinded by the COVID pandemic, but would have done exactly that for the people of Ontario. I think in the short term, that would really help. And then, of course, there are the long-term solutions, like I mentioned earlier when I was talking, is increasing the number of physicians by having more medical schools, which the government is doing, and making sure that long-term supply of physicians is there. And finally, we need to do a better job of just having a good look at the international medical graduates that are in our community. There's a lot of international medical graduates who are not licensed to practice. We need to do a better job of scoping them out, making sure that they've had appropriate training for Ontario, and figuring out a way to get the ones who have been appropriately trained licensed in the province.
Thank you for that answer, Dr. Gandhi. The next question is for Dr. Kassam. Dr. Kassam, you mentioned the Canada Health Transfer. The question is, without a promise from the federal government to up funding, can enough be done by a provincial government to really make improvements in our healthcare system?
What I've said before is that healthcare is a team sport. And just like we're talking right now here on this panel about sharing care across providers and across groups, across geographies, across regions, the same goes for funding sharing across different jurisdictions, including a federal and a provincial level. We believe that there should be a floor of Canada Health transfers to 35%, up from the current 22%. We have called and stood in solidarity with the premiers at their last Council of First Ministers, calling for exactly that. And I believe Premier Horgan was the chair of that particular meeting, and we were happy to advocate in addition to some of the other premiers across the country. And so what is clear is that we just don't have enough funding from a federal level. And when we think about where Medicare began back in Saskatchewan, it was actually a 50-50 proposition between the federal government and the provinces. And we've seen the whittling away of that particular agreement over chronically underfunded systems over the past 30 to 40 to 50 years, right across the country. And so our belief is that we need a bigger hand in terms of helping from the federal government. We know that there have been commitments by all levels of government to increase funding, but we also believe that the share of spending should actually be increased at a federal level in conjunction with increasing those Canada Health transfers to a floor of 35%.
Thank you, Dr. Kassam. The next question is for Dr. Zacharias. We know that mental health issues have worsened during the pandemic. What programs are needed to address these, and is enough being promised in the different platforms?
So what we need are community-based, publicly funded mental health care teams. Really, we do want to give every Ontario a primary provider, a family doctor that's able to navigate the system and care for people and their families. But to put on one solo physician what people show up with when they are struggling with their mental health doesn't make sense. We need to have teams. You know, when I've been in the emergency department for years, and I know when a patient is getting good mental health care, they are met with, by a mental health crisis worker, sometimes before they see me as the physician in the department. And then they are helped with discharge to community programs by a discharge planner, a navigator, someone who knows all the community services and can make those connections for them. Sometimes we're doing that with families on behalf of their teenagers. Sometimes we're doing that with adults on behalf of their elderly parents, because it takes a lot to navigate out there what is available, what programs are going to be most helpful. And so that is really what we need to see. We need to see those mental health teams. They need to be publicly funded, more psychotherapists in the system, and indeed, you know, the primary care doctor to be at the hub of that. But that really is what we need. So. And also, I mean, all of our recommendations really just feed into freeing up resources. We've talked about documentation. Virtual care is a good opportunity for patients to meet with their family doctors, and that we were forced into that in COVID, and now we're actually opening the gates for increased access through virtual care. But every time you get a doctor in front of a computer, there's just lots of buttons to click. And so we need to, as Dr. Gandhi was saying, just decrease the burden of the click, 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 and the more relationship building, trust building, and patient facing time that it takes, I think, to care for someone with mental health issues particularly. And so that's how we need, and we have achievable solutions. It's in our prescription for Ontario, and so that's what I look forward to seeing some changes around.
Thank you. This next question comes from Ray Chan from Singtao Daily. I'm going to direct it to Dr. Gandhi. Maybe if you could speak a little bit about this. The reporter would like to know if incentives for foreign trained doctors to rural areas can solve some of the shortage. He's also asking about a number of foreign trained doctors who complain that they pass the exam, but then they don't get a residency. So is there any solution to that?
Yeah, and that's what I was alluding to earlier. I think that it's important for foreign trained physicians. I know foreign trained physicians are willing to work in rural Ontario, even without the biggest incentives, because they're physicians. They want to look after patients. They want to go where people are sick, and they want to help patients. And I know this because for 28 of the past 30 years, I've been a preceptor with the University of Toronto, where I train medical students and residents. And I've had some foreign trained physicians, the international medical graduates, come through my practice as well. So I've had some experience with them. I think that there's two parts to ensuring that a foreign trained physician is properly vetted. The first part, of course, is the exam, and it's important to make sure that the foreign trained students, international medical graduates, they pass their exams. And the second part is for them to pass a residency. And I do believe that there is an opportunity to increase the number of residency spots that are available for foreign trained graduates to ensure during the residency process that the standards that they were taught from wherever they came are appropriate for Canadian standards. So we do need to increase that number as well.
Thank you. This next question is for Dr. Kassam. If there is another COVID wave in the fall or the winter, what should whichever party forms the next government do differently?
Well, I think that first of all, we need to learn from our previous waves as far as not only appropriate public health measures up and down, meaning ramping up and ramping down in a timely way, but also in a consistent way across the province. I think part of the challenge really has been an inconsistency at a public health level. And that is partly due to a variety of different governance models that aren't really streamlined. And so part of what the task moving forward really is to ensure that there is sort of a top-down, perhaps, command center with appropriate governance streamlining so that there can be consistency across the province, but also flexibility to meet local needs. So I think I would say that the first task at hand moving forward is to ensure that there is appropriate and proper governance. And the second, of course, is to ensure that we're supporting our healthcare workers in these moments of need. We know right now that we are short-staffed at hospitals like Dr. Hill's and others across the province. And so ensuring that we have not only appropriate PPE isolation protocols, but also flexibility to ensure that care delivery can continue, especially in the context of what is now 22 million healthcare services that have gone delayed. So there has to be a balanced approach moving forward. And I think that if we can learn anything from the past several waves, we should be able to adopt some of that in our, not only our strategy and planning phase right now, but should the need arise to implement any and execute any of that strategy.
Thank you. The next question is for Dr. Hill. If patients are showing up sicker and later after COVID lockdowns, how much can we expect the backlog to grow in the coming months and years?
It's a great question. So we've seen it grow by 1 million over the last few months, and we can continue to expect that to persist. And in fact, it will not just persist in growth, but it will be exponential. Because what we're going to see happen is patients come into hospital and they won't be able to leave the hospital. Deconditioned elderly who would have previously gone home after their hip surgery or knee surgery have been at home suffering for so long and have lost so much muscle tone that they aren't able to get back home. And so they wind up either in a rehabilitation center that they might have been able to forego, or they need to go to a long-term care center because they never get back to independent living. That's not just a cost and a timeline issue. That's a personal life issue. That's a quality of life issue. And that's something that we need to be taking very seriously. We talk about heart surgery, which is what I do day in and day out. Our normal routine is patients go home 4 or 5 days after surgery. That's what happens with uneventful heart surgery. Yeah, sure, you don't feel great for a couple of weeks, but you're at home and you can recover. The patients that we're seeing now who are coming in with long-standing congestive heart failure need to be diuresed for days before they can have surgery, and then they undergo more medical therapy after surgery before they can go home. We see patients who are coming in who have had heart attacks that went undiagnosed over the pandemic. And so instead of coming in with a normal heart that just needs a bypass, now they have a sick heart that needs a bypass, and a sick heart means a sick patient. So we can expect these numbers to continue to grow exponentially until we make better use of the physicians and the healthcare workers that we do have, until we enable patients to get care wherever and whenever they need it, including at items like the ambulatory care centers. We need to ensure that our foreign graduates who are here can be employed. We need to ensure that all the underemployed surgeons are employed. There are a number of orthopedic surgeons across Ontario who would love to set up a shop at one of these ambulatory care centers and fix 5 to 10 knees or hips a day. I'm not even sure what those numbers would be, but haven't been able to do that because of all of the bureaucratic issues around it. And so you're right, to the person who asked that question. We can expect the numbers not just to increase, but to continue to increase dramatically. And the choice is ours, and the choice is the government's, as to how much will and finances are we going to put into taking care of our patients, taking care of Ontarians.
Thank you for that answer. Reminder to media that you can put questions at any time in the Q&A chat. The next question is going to Dr. Kassam. Dr. Kassam, can you tell us how important is party alignment with the OMA's prescription for Ontario?
So I think the first thing to say here is that we're taking a nonpartisan view of this election and every subsequent election. In fact, we've never been a partisan organization, and we don't intend to be. But alignment is very key. We know that stakeholders need to be aligned on a number of key portfolios and issues in order to see progress, whether that's government, the OMA, whether that's the Ontario Hospital Association, whether that's other forms of care delivery in the sector. We need to have alignment and strong alignment, especially if we want to get to a point of integration that is actually not only efficient, affordable, but also sustainable. And so I think that our proposal with the this prescription for Ontario, which again is a nonpartisan document. We don't care if you're left, right, center, up or down. We know that healthcare is a team sport. We know that healthcare is nonpartisan. And so that is the view of our organization. But we do believe in strong alignment with government, with other organizations and stakeholders. And we're going to continue to advocate for that alignment now and into the future.
The next question is for Dr. Zacharias. How frequently will the report card be updated?
So we do intend to update the report card. We had shared our prescription area with all parties, and we are determined to see each party adopt and then, of course, whichever party forms government to implement. And so as the party platforms become a little bit clearer around healthcare strategies, we will be updating the report card. So you can just be aware of that, and we will be definitely happy to share that as we go forward. Not a particular time interval per se, but we will be updating the report card going forward.
And another question for Dr. Zacharias. Why did the OMA prepare this report card, and why release it right now?
We experienced a pandemic, and the pandemic exposed gaps in the healthcare system. And it is Ontario's doctors' mission to lead people to better health. And so it's what we do as doctors. We look and observe and make recommendations. And so it's not just us as physicians. This was an extensive stakeholder exercise. And so Ontarians have come forward, multiple stakeholders have come forward, including multiple healthcare stakeholders in the medical health sector. And so we feel very confident putting these recommendations forward under these key pillars, and indeed talking the most important priority about catching up with the backlog, and then all of the other pillars that follow through. 87 very specific recommendations that are achievable, but will need alignment going forward to see them achieved. And so it's really what doctors do, leading people to better health. And so writing prescriptions actually is also, and so writing this prescription for Ontario is exactly what we wanted to do.
One more question for Dr. Zacharias about the report card. Is the OMA planning to release report cards beyond the election?
It is our intention to, we're determined to see whatever party forms government implement the report card, implement the prescription. And so we intend to hold the government to account and updates, whether it's an absolute formal report card and we do the stethoscope approach, I'm not sure, but it is definitely our intention to see the prescription for Ontario implemented post the election.
Thank you. And a final reminder to reporters that if you have questions, you can put them in the Q&A chat. We have one final question for each panelist. Where do you hope to see the Ontario healthcare system 1 year from now? Maybe Dr. Gandhi, if we could start with you.
What I hope to see is that, when you look at the recommendations that that the Ontario Medical Association has put forward, I would hope to see that we make a lot of progress on those recommendations. And I would hope to see that when you look through the recommendations, there's some that can be done very, very quickly. For example, setting up an independent ambulatory center is something that can be done relatively quickly. That's not something that's complicated to do. And there's lots of examples of other independent ambulatory health care centers across the province where we can use as a model. If you look at the digital health team for a patient, that, as I mentioned earlier, that was my passion when I was president of the OMA and unfortunately got sidelined. The OMA had some plans to try and have an app that patients could use to access their healthcare providers and to serve as a communication platform for their healthcare providers to provide that digital care to support them. That's low-hanging fruit, right? Like that's something that can be done very, very quickly and very easily. So I would hope that whoever wins the election listens to Ontario's physicians, recognizes the fact that Ontario's physicians have taken a leadership role in healthcare and have also brought in other stakeholders, as Dr. Zacharias and Dr. Kassam and Dr. Hill have pointed out, and have come up with a plan that really we can make some tangible progress on.
Thank you. And over to Dr. Zacharias. Where do you hope to see the Ontario healthcare system in 1 year from now?
Well, it is a goal that every Ontarian would have a family doctor. And I know there's 1 million people right now that don't have a family doctor. And it breaks my heart. And it's just such a practical from the emergency department perspective. When we discharge patients, we don't finish really the care plan. We always intend to have that person follow up with their family doctor, to have their prescriptions refilled, to have their care plan implemented, to have those checkups done after the acute diagnosis was made in the department, to possibly avoid a return and a bounce back to the emergency department. And so without a family doctor, there's just a lot of people struggling and falling through the gaps. And indeed, I want to see a robust mental health care strategy. And so those publicly funded, team-based community healthcare teams that focus on mental health in a new and different way. I don't know. I mean, did it take a pandemic to really bring it to our minds that our mental health is as important as it is, but prioritizing it as a healthcare system is indeed what I want to see.
And Dr. Kassam, your thoughts on where you'd like to see the healthcare system go in 1 year?
Yeah, I think better integration is going to be key if we want to try and get in through and make a dent in the backlog. I think that's going to be key priority number one for the sector. How do we get people the care that they need at the time that they need it? And really listening and enabling and empowering physicians to do their job effectively is going to be, I think, frankly, a key ingredient for success moving forward.
And Dr. Hill, over to you.
Thank you so much. And so where I want to see the healthcare system a year from now is having taken a good hard look at itself and being able to implement the lessons we learned over the COVID pandemic. They say that there should be no wasted crisis. Well, we've had our crisis. We're coming through it. We're not done yet, but we're coming through it. And now is the time to put into practice all of those lessons that we've learned. We've learned how fragile our healthcare system. We've learned how fragile our public health system was. We've learned how fragile our healthcare workers and our healthcare worker supply was. We've learned how fragile our mental health was, not just in healthcare, but across Ontario as a whole. We've seen our children suffer. We've seen our children suffer because of decreased access to school, but also decreased access to the care that they needed. That was allied care and that was surrounding medical care. So a year from now, I'd like to see Ontario ranking first amongst Canadians for healthcare. I'd like to see Canada ranking way up on the OECD countries as opposed to where we currently are. I'd like to see our preventative healthcare in children and in schools building towards a healthier future. It's going to take years to undo the pandemic and the years before that, because let's face it, we had an issue with wait times a long time before the pandemic started. But let's get us to a place where Ontarians are healthy, where Ontarians' healthcare system is healthy, where it's sustainable, where we're employing people who are happy to be employed and who are excited to be coming to work, where we've allowed foreign graduates who qualify to be part of our healthcare system and provide care to all of those who need it, where we've invested in these ambulatory care centers, and having your surgery is no longer a matter of necessarily going into a big city and staying at a hospital. It's something that's possibly closer to you, and it's something that's much more feasible. And we've reduced the cost of all of this by taking into account all of these suggestions that the OMA has made.
Thank you. And we're nearing the end of our time. So I'm going to hand it back over to Dr. Rose Zacharias for some closing remarks.
Thank you so much, Emily. And thank you everyone for attending today's briefing and for your very thoughtful questions. We certainly hope that the information we provided to you today was helpful. A copy of the report card can be found on betterhealthcare.ca. And I look forward to watching and reading your coverage. If there's a topic you would like to hear doctors discuss in the future, please send along your suggestions to media@oma.org, and we will address those in the future. Thank you again your time, and best of luck with your election coverage. It is certainly an extra busy time of year for politicians as well as journalists, and we encourage everyone to take some time to look after themselves and to ask a colleague also how they're doing. It just goes a long way, genuine care and concern. So thank you so much for being here today. Bye for now.